everyone. Welcome to Care Culture Talks. My name is Eyal Heldenberg. I'm the CEO of No Barrier, AI medical interpreter for healthcare providers. I'm very happy to have with us Dr. Ilan Shapiro. Dr. Shapiro is advisor to No Barrier, so happy to have you.
Oh, it's a pleasure. I'm very excited to be here with you.
Perfect. Amazing. So basically, the podcast purpose is to learn from healthcare professionals from their experience around language accessibility in healthcare and cultural competency. So first, Dr. Shapiro, would love to kind of get to know you and your background in medicine.
Gladly. Well, I'm born and raised in Mexico City. I did my MD degree over there. And afterwards, I worked as a liaison between the WHO and Mexico. I love that because I got to see, what was the healthcare system in Mexico and also compare it in policy with other communities and countries. Then that actually opened not just like the little pueblitos, the little towns that I was actually taking care of, or the big cities in Mexico, but also the perspective of the importance of culture, language, and you're there and there's like at least 50, 60 languages around you. And that actually opened my mind. And that continued during my pediatric training at Mount Sinai Hospital in Chicago, where we had absolutely very amazing Latino community and also an African American community, but also a very important migrant community that they came from Russia, they came from Vietnam, they came from a lot of countries, and they were all together tied with health. That's something that we all need. Then on my entire background and travel from place to place, from Chicago to Fort Myers, Florida, and right now in Los Angeles serving Altamed, a Fair Qualified Health Center. Um, the continuum of the importance of being there with your patient, having knowledge, because you don't need to be an expert of the cultural aspect of it, but also the linguistics part of it makes a huge difference for treating our communities and also bringing better quality outcomes.
Perfect. I think you have like a kind of a very unique background coming, from example, from the Latino community. And, I wonder, there are some unique communication challenges you might encounter as a medical provider. Would you like to kind of address unique challenges of communications with Latino communities?
A lot of the times, the first one and the most common error is to think that all Latinos are the same. And it's clearly not true because if you see the difference between an Argentinian, a Mexican, a Dominican, Puerto Rican, it's different. Maybe the Spanish, we can understand each other, but there will be certain words that would not translate from one side to another. And also the cultural aspect of it, because there are very regional or very localized things that are very different on how they see mental health, how they perceive vaccines, how they actually want to take care of themselves with, alternative medicine. Then all of these things are crucial and important in order to actually take care of our patients. Because we're not just seeing a language, we're seeing the entire package. But of course, if you don't have the language, you have that first barrier between you and the patient.
Yeah. All right. You mentioned that you are now working at Ultimate. So I wonder if you can take us to how Ultimate navigates now the language barriers when providing care. Are there any particular approaches that you practice there?
We, from the beginning, on the onboarding of our nurses, front staff, physicians, everybody actually gets the tools on how to communicate with a patient. And we have a very diverse set of patients. And part of it, it's understanding what do we have at hand. Then we have different modules from actually in person, someone actually translating that are certified to do so, or actually a telephone number, or we also have the technology that it looks like an iPad practically that you call, you press on it, you select the language, and it actually goes to a database or central base or whatever, and you have an interaction with a human that it's actually translating for you. Um, And in this way, at least if we have sign language, if we have Cantonese or Spanish or whatever language we have in front of us, we can actually leverage all these tools in front of us to connect with our patients.
Perfect. Since you are a kind of a native speaker in Spanish, I wonder if during your career you had other, monolingual providers that you approach. Hey, Ilan, could you help us with this patient, with that patient? Just kind of getting this your knowledge around that.
Probably I share the same story as many other physician, nurses, and people in healthcare, where they were the only ones that actually spoke a language that was not typically used in the healthcare settings. Then, since I was a medical school, a med student, and in residency, and still today as a provider, as a physician, um, always there's someone like, can you come in? Can you help me translate? Can you do that part? Can you bridge that gap that we have right now? Because I'm not getting the full picture. And it makes a huge difference. First of all, I love doing it because one, I am helping my partner in crime, my fellow physician, my nurse, my team member. And the second one is that I'm most importantly helping my patient, because at the moment that we raise our hand and go like, well, I need help, can you come in? I love doing that part, but with that part, a lot of us end up doing a double job, because you need to take care of your workflow, you need to take care of your things that you're doing, but also at the same time the translation. That's a second job, at the same time that you're doing your own things. And that's kind of what I kind of saw, and I'm still seeing, for the past almost 20 years that I have been practicing.
Yeah, we heard stories. I had a chat with one Cantonese speaking provider that, a couple of months, he was approached by colleagues and he just couldn't have enough time for his patients. So he shared that he started to kind of push back for hey, just use the formal solutions. You have, medical interpreters available. So he kind of navigate between his patients, but also the need to help others. So this is the way he chose, kind of to put some boundaries, but totally get kind of the pros and cons um, of that. Um, we've discussed medical interpretation now. I wonder, from your perspective, what kind of evolution in those services in healthcare you see, or where do you see room for improvement?
A couple of things. When I see my patient, we have all this technology that it's there, it's helpful, but it takes time. It takes a process to get there. And it's very cumbersome sometimes, even though that it's maybe a simple click or waiting and stuff like that. But if you multiply that for a normal day between 20 and 25 patients, and you're adding 2 minutes, that's almost, an hour and a little bit more of your time that you're spending just waiting for the machine to connect. Then having all these things actually align on an easy way would be something that I really, really cherish. Because sometimes you're waiting for the translator, you're waiting for the telephone to be picked up, or like, there could be like little kinks there. They start adding to the process. And of course, you're going to be there with your patient. You want to actually be there with your patient. You want to talk with your patient, but these barriers at the end of the day actually takes a toll on the physician, the nurse practitioner, the practitioner that is actually in front of the patient, the nurses, um, that are trying to do something, but because of this technology that it's actually helping us, because before it was horrible, there was really nothing, um,
Yeah.
create a time lag that starts accumulating, and it's not kind of the best approach that I'm seeing.
Right. So basically, you say like the room for improvement is around the waiting time, the access to care. Like, can we do it faster, in a sense?
Completely, and also give that tools to the patient, because when they call your office, when they go to the pharmacy, when they're doing other medical stuff, they need that tool also, because sometimes actually it happens, and it's a great example. When they go to the pharmacy, the script maybe is not on the language that they have or they perceive or they prefer. Then imagine that they actually have a tool to translate and have that part on their language, and actually that it's not just like translate from the limbo, but it's something that actually is making a difference for them, that it's actually medically graded. Then that actually can help a lot.
Right. So technology in the hands of the patients could empower them.
Completely.
Got you. Yeah, yeah, makes sense. All right, perfect. Now I would love to kind of talk about any other cultural factors that you find most important to consider when treating patients from diverse backgrounds, besides language.
One of the most important parts, and I love doing this, that it's actually learning a little bit more of the culture. If you have a set of patients that are coming from a certain area from China, or a certain area from Mexico, or Dominican Republic, or Ethiopia. You choose whatever country you want, but actually learning a little bit of their culture, what's actually appropriate, what's actually the way that they want to be perceived and approached. That's very important. For example, for Latinos in general terms, it usually touching, saying hello with a hand, having a closer space. Actually, it's okay. And also the eye contact is very important, actually giving space for them, and the respect to the patient. And also they see the doctor as someone that actually is bringing a lot of empowerment for their families and their future. Then sometimes they are afraid to ask, and it's not because they don't want to ask, it's because they don't want to offend the doctor.
Mhm.
Then making sure that we are understanding not just the language but the cultural aspect, and that we are taking care of a patient. And that it also includes a lot of the times the background of asking my patient, do you take any medications? And they go like, no. Then after that I go like, well, okay, medications or medicines could be natural teas and stuff like,
Mhm.
teas, yes, and they give me a huge list of vitamins and teas and other stuff. Then making sure that we are in tune with the cultural aspect of it, and of course using the language to actually bridge that gap.
Yeah, yeah, totally makes sense. Are there any, um, I would say, deeper beliefs? We heard, for example, about some populations, with kind of less of, trust maybe in healthcare, or at least, the conventional one. Um, Kind of like uh, different beliefs. I don't know if from the Latino community or others. Like, how do you see this kind of other belief when they enter the room?
Oh, it's very important, because the way it's kind of going to a marathon without training and without knowing that you're actually going to not make it the first mile. Then
Yeah.
the entire idea of this is actually to have that expectation, to open the door to where they're coming from, because a lot of the patients that I take care of, they have two or three jobs. They are like very they're fighters. They're doing their own good, amazing things, and they could be afraid. Maybe they have not been in the doctor for a while. Maybe they just don't like the procedure, and that's totally okay. Then we need to be open for that part. And most importantly, even though that we can group the Latino community in one group, or the African community in one group, or the African American in one group, it's very important that at the end of the day, we're still individuals, and we all have a different type of experience on what's our day to day, where we and what are we actually doing with our health.
Yeah, yeah. Um, one of the previous guests mentioned on for the Asian communities that there are some family dynamics where, for example, the mother could take decisions in the family, right? You need to consult other family members. I wonder if there is some family dynamics of patient in the Latino community where more people needs to be involved. Maybe the provider needs to talk to the, I don't know, grandfather in the room. I wonder if you have kind of any insights on that part.
One of the best well-kept secrets of absolutely everything that we have in front of us is that the female figure, the grandma, the mother, actually carries a lot of the healthcare power of the family. They are usually the uniting force of the Latino household. Then a lot of the times, and we have seen it with procedures for, screening against cancer, vaccination, and other stuff. That usually, if you have and you attach a lot of the conversation with the female part of it, the mom, the grandma, actually that can carry a lot of weight on medical conversations. And at the end of the day, everybody needs to choose whatever path they want to do, but that actually starts that conversation in a larger scale.
Yeah. All right, perfect. So I wonder if if you could implement one major change across the healthcare system to improve care for patients with language or cultural barrier, like what would it be in that sense? Like one change.
Um, I would love, 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 love to actually have uh, the tools and everything empowering to empower our patients. And technology where I can actually be with my patient and they can be with me without that cumbersome circulation of having a computer and it's slow and connecting, something that can actually make it more efficient, not only for me, because my nurses actually are talking with my patient first. My front desk is actually talking with my patient first.
Hmm.
And making sure that all of those steps are actually integrated and we leverage the time and technology to actually be taking care of our patients and taking care of us as physicians, providers, nurse practitioners, healthcare, anything that there is touching a human. That way we can save time and of course, most importantly, be with our patients and improve their health.
Yeah, amazing. Basically, you say we need technology to save us from technology, in a sense, right? you need to you need to have the second generation to automate the EMR, automate the interpretation, automate like everything. So in the room, there will be like the I don't know, the regular bonding like 200 years ago, right, between the doctor and the provider. Yeah.
That's part of the beautiful part of it. That and I love your definition of saving us from technology by technology, but that's kind of true. It's kind of at the beginning the technology was actually using a letter and mailing it out, and right now after that was an email, and right now we're chatting. Then yes, probably that will be a faster way to actually have some type of technology to make the difference.
Perfect. All right. I think we are in the kind of last kind of question of practical advice. So I wonder, like, what advice would you give, to healthcare providers, a healthcare organization who wants to improve their, ability to provide this culturally responsive care, whether language, cultural, or other.
The first part, and it's if you already know that you're serving a certain type of population that comes from a certain ethnicity or have a certain language, try to understand before the language, the culture. Where are they coming from? What's the expectation of the interaction with the doctor? And in the old days was like, actually, you need to go to that place to actually experience it. Right now, you can actually Google it and you will have a decent answer on that part. And try to actually find that part. Learn a couple of phrases in their language. That
Nice.
actually opens a lot of doors because it creates that bond that you're at least trying to connect. And of course, having technology that can improve the way that I talk with my patients. And because even though that I mainly have monolingual or bilingual patients, Spanish, English, I still have my Mandarin patients. I have Cantonese patients. I do have patients that actually speak other languages, including, Russian. Then, having that ability on my pocket on me or in their pocket as patients, that would make a huge difference. And that's what I really want from healthcare systems and also medical providers to get that you have the linguistic part that is very important. And sometimes we cannot manage it that much, but the cultural aspect, we do have a lot of power for that one.
Amazing, amazing. Basically, you say even with small steps, like those gestures that you now mentioned, like the small steps basically could do like a big impact in the room.
Completely.
All right, perfect. Thank you so much, Ilan, for being with us in Care Culture Talks. Appreciate it.
A pleasure as always, and hope that we open a lot of the linguistically and culturally concordant care that our patients deserve.
Thank you.